Assalamu alaikum. Welcome to the Pharmacos YouTube channel. Today in this video, I will discuss briefly pneumonia, its types, symptoms, diagnosis and the treatment. So let's start the discussion. Pneumonia is an infection in the lung tissues caused by the microbes and the result is inflammation. This inflammation brings water into the lung and that extra water can make it harder to breathe. Now firstly see how pneumonia developed. During inhalation, air reaches your lungs by traveling down your trachea, then it continues through bronchi and bronchioles and end up in alveoli. Alveoli are tiny sacs that are wrapped up in a net of capillaries. This is where the majority of gas exchange happens in the lungs. Oxygen leaves air in alveoli and crosses into the bloodstream, while carbon dioxide leaves bloodstream and is then exhaled out of the body. Now in addition to air, you are constantly breathing in other stuffs like microbes, but we are usually good at protecting ourselves. For example, we have mechanical techniques like cuffing, a mucociliary oscillator that lines the entire airway and moves out larger bacteria that are nestled deep inside alveoli and ready to destroy anything that lands here. But sometimes a particularly nasty microbes might succeed in colonizing the bronchioles or the alveoli, and when that happens you have got pneumonia. These microbes typically multiply and crosses over from airways into the lung tissues, creating an inflammatory response. These tissues quickly fills with white blood cells as well as proteins, fluids and even red blood cells if a nearby capillary is damaged in this process. Now, there are lots of different pneumonia causing microbes. Usually it's caused by viruses and the bacteria, but it can also be caused by fungi and a special class of bacteria called mycobacteria. In adult, the most common virus that cause pneumonia include influenza, respiratory syncytial virus and the rhinovirus. In adults, bacteria causes include Streptococcus pneumoniae, Haemophilus influenzae and Staphylococcus aureus. There are also more unusual bacteria like Mycoplasma pneumoniae, Chlamydophila pneumoniae and Legionella pneumophila which don't have cell wall and are well known for causing an atypical or walking pneumonia. In individuals with a normal immune system, fungi are a rare cause of pneumonia and often it's regional. One special fungal culprit is Pneumocystis jirovecii, which is a risk factor for immunocompromised individuals. Finally, there is a mycobacteria, which is most well known as Mycobacterium tuberculosis, also just called TB. Pneumonia can be categorized by how and from where it's acquired. The most common is community-acquired pneumonia. Community-acquired pneumonia occurs when a person gets sick outside of the hospital or healthcare settings. Next is hospital-acquired pneumonia or nosocomial infections or pneumonia, which is when a person gets pneumonia when they are already hospitalized for something else. This type tends to be more serious because sick patients often have a weakened immune system and microbes in hospitals are often resistant to common antibiotics. This type of bacteria are able to swap some of antibiotics resistant genes with one another. A well-known example is methicillin-resistant Staphylococcus aureus or MRSA. Non-resistant Staphylococcus aureus can cause pneumonia and other infections, but it can also be killed by some common antibiotics like ampicillin. MRSA, on the other hand, is resistant to many antibiotics and is therefore harder to treat. Another category of pneumonia is ventilator-associated pneumonia, which is a subset of hospital-acquired pneumonia, but it specifically develops when ill individuals are connected to a ventilator. It is developed due to a biofilms, which is a mixture of bacteria, sugars, and the protein that can coat a surface that forms on the endotracheal tube. Individuals on a ventilator cannot cough and are often quite sick already, so over time microbes move from the tube directly into the lungs and cause a pneumonia. Now, in addition to inhaling microbes, there are other ways to develop the pneumonia. One of the examples is aspiration pneumonia. Aspiration pneumonia is acquired when a patient aspires bacteria into the lungs, usually from the food, saliva, or even gastric contents, like after a bout of vomiting. Aspirated gastric contents can be particularly nasty because stomach acid can cause a chemical irritation in addition to possible infections. Another way we can categorize pneumonia is by where the infection is located in the lungs. In bronchopneumonia, infection can be throughout the lungs involving the bronchioles as well as the alveoli. In atypical or interstitial pneumonia, the infection is mainly just outside the alveoli in the interstitiums. And in lobar pneumonia, the infection causes complete consolidation of a whole lobe of the lung, meaning that entire region is filled with the fluid. The vast majority of these are caused by Streptococcus pneumoniae. Usually, lobar pneumonia happens in the stages. The first stage is congestion and it happens between 1 to 2 days. This is where the blood vessels and the alveoli start filling with the excess fluid. The next stage is red hepatizations and it happens between days 3 to days 4. This is where the exudates which contain red blood cells, neutrophils and the fibrin start filling air spaces and makes them more solid. The name hepatization refers to the lungs taking on a liver-like appearance from reddish brown color of the exudates. The third stage is grey hepatization, which happens around day 5 to 7. In this stage, lungs are still firm, but color has changed because the red blood cells in exudates are starting to the breakdown. The last stage is called resolution and this happens around day 8 and can continue for 3 weeks. In this stage, the exudates gets digested by the enzymes, ingested by the macrophages or coughed up. The signs and symptoms of pneumonia can vary in severity from person to person. Here are the most common examples: productive cough, fever and chills, tachypnea, shortness of breath, chest pain, diaphoresis, fatigue, cyanosis. Keep in mind that other signs and symptoms for pneumonia exist. These are the just common examples. Now let's talk about the risk factor for pneumonia. It's true that patients of all the ages can get pneumonia, but some are more at the risk than others. Here are the risk factors. You have infants less than 2 years of age, adults who are greater than 65 years of age, those with weakened immune system, those with chronic conditions such as asthma, COPD, and congestive heart failure, those with recent respiratory infections such as flu or common cold, those who have intubated and receiving mechanical ventilatory support, those who smoke tobacco, those who have recently a stroke attack, and those who are exposed to pollution or lung irritants. Keep in mind there are other risk factors for pneumonia. These are just common examples that you should be familiar. Diagnosis of pneumonia is usually made in a person who is working hard to breathe or breathing quickly. It is most commonly diagnosed by looking at patient's chest X-ray, which will show signs of the consolidation. A chest X-ray of bronchopneumonia typically shows patchy areas that are spread throughout the lungs. In atypical or interstitial pneumonia, the pattern is also often spread throughout but is often concentrated in the prealar regions and looks reticular, meaning there will be more line shapes opacities visible in chest X-rays. In a lobar pneumonia, fluid is localized to a single lobe or a set of lobes. Another way to detect a lobar pneumonia is to look for dullness to percussion, which suggests that there is a lung consolidation. There is also tactile vocal firmness, which is when you can feel more vibrations from a person's chest or back after they repeat certain phrases. This is because sound travels better through the fluid-filled consolidated tissues than the air-filled healthy tissues. Other tests and findings to look for includes vital signs, arterial blood gas results, pulmonary function test, sputum test, complete blood count, CT scan, and pleural fluid culture. patient's pulse oximetry would likely reveal hypoxemia, and a faster breathing rate is common as well. The patient's breath sounds through escalation will likely reveal crackles or ronchi, and if you were to perform a chest percussion, a dull sounding note would likely be heard. The patient PFT result would likely reveal decreased lung volume and the capacities. Complete blood count or CBC would provide patients white blood cell count in order to help determine if the infection is viral or bacterial in nature. For instance, increased WBC indicates that a bacterial infection is present, and decreased WBC indicates that a virus is causing the infections. The treatment of pneumonia depends on the type and the severity of pneumonia and should be treated on a case by case basis. But in general, here are the common treatment methods. Since bacteria are most likely cause, antibiotics are often prescribed. In addition to the antibiotics, oxygen therapy, bed rest, airways clearance therapy like pertussive or antitussive, hyperinflation therapy, and the fluid management. Again, each patient will be treated differently depending on the cost and the severity of the symptoms. In severe cases, intubation and the mechanical ventilation would be indicated. So this is the brief and complete overview of the pneumonia.